here, imagine for a moment to be one of the 786,000 Americans that each year, because of kidney failure, end up tied to a machine for life. It all would start with a diagnosis of chronic kidney disease that came too late, accompanied inevitably by a prognosis that's all but favorable. A story that we have heard many times, alright? Only this time with a plot twist. So imagine this now. Your condition, CKD, is not a life sentence anymore. Your condition can be treated by managing a single mineral with the use of a combination of natural supplements. You are actually able not just to avoid dialysis, but to go back to stage 2. And what stage 2 CKD means is not just not having to undergo dialysis, it means not having to follow a renal diet anymore. It means not having to do any therapy at all for kidney disease. Now guys, what we are looking at today is no work of fiction. This is a case study. This was published as part of an article on a peer-reviewed medical journal, Reversing Chronic Kidney Disease with Niacin and Sodium Bicarbonate. This is the title of this article. As we will see, this is the story of an 81-year-old man who was diagnosed with CKD only when he was in late stage 4 already. Because even if he had received a quintuple bypass, and even if he was suffering from prediabetes and high cholesterol levels, no doctor ever thought about checking his kidney function. Not until symptoms of kidney failure started to show up, but that's usually way too late already. Well, not in this case. Because you see, this man was able to find a therapy that worked. His secret? Taking supplements aimed at aggressively controlling his serum phosphorus levels. Okay, wait, now you may ask, is controlling serum phosphorus levels enough to reverse CKD completely? It can in certain cases, because you know, the thing about chronic kidney disease is that it's an umbrella term, alright? CKD is not a single disease. It's a group of conditions that affect the kidneys in different ways. There are many different causes for it and many possible treatments depending on the cause and the stage, which means that every patient is different. But there is one thing that's going to be the same for every single kidney disease patient: phosphorus. I want to be very clear on this. If you have CKD, getting your phosphorus levels down may be the key to reverse the progression of the disease. Excessive phosphorus is toxic to the kidneys as well as virtually every organ system in the entire body, which means that there is no way you can improve with CKD if you don't get your phosphorus levels down. So what I want to share with you today is the best strategy to manage phosphorus levels. This is a very often underestimated level for CKD patients that can actually make all the difference in the world. It can make the difference between ending up in dialysis and getting back to stage 2. So yeah, for this patient, phosphorus alone was the key to get his creatinine levels and kidney function back to normal. And well, you can do the same. Today we will see how. So if you think this video is informative, please tap the like button and also consider sharing it with a friend so more people will be able to see it. And now you may ask, I'm already worried enough about my potassium levels, about oxalate, about uric acid. Are you sure I should also care about phosphorus? Well, phosphorus is one of the most important renal toxins, but it doesn't just damage your kidneys, it can literally kill you. Most studies today are linking higher serum phosphate levels to a higher mortality rate in those with CKD. Because you see, when the kidneys cannot filter phosphorus efficiently enough, it will bind to calcium and it will cause vascular calcification, which is a cause for heart disease, heart attacks, strokes, and more. This is why I believe that having too high serum phosphate is probably even worse than having too high potassium levels. Phosphorus is one of the reasons why dairy products, meat, and fish are forbidden for people with kidney disease today, alright? In fact, if you still have protein sources in your diet, they are probably low phosphorus protein foods, such as egg white or beans. Now, this is very important. Controlling phosphorus levels was key in this case study for the huge improvement in kidney function obtained. This patient would have never been able to get back to stage 2 without managing phosphorus levels. Your diet and treatment in general should be based on this level if you have CKD. So now you may ask, how was the 81-year-old patient able to get back in stage 2? What he received is a 3-way treatment to control his phosphorus levels, and that was key to his improvement. What they used in particular was calcium carbonate, which I often recommend here because, well, it works. So he took calcium carbonate in a dose of 2 to 4 grams of calcium carbonate antacid tablets per day at meals, and also sodium bicarbonate at 1.8 grams per day. This is also crucial and something I always recommend because it helps with metabolic acidosis. And also very important, niacin. Niacin is the main reason why this study was published. You see, this vitamin is not usually taken in order to manage phosphorus levels, but it may also help with that. The author of this study thinks that niacin is one of the main reasons why this patient was able to get back in stage 2. Niacin has phosphorus lowering effect and it also works against proteinuria, but the way it was administered in this study is very different from how I usually see kidney disease patients take it. This is why I will circle back to niacin in the next part of the video. Before that, very important, are your phosphate levels under control? Okay, now guys, it's 100% clear that without an adequate strategy to control phosphorus levels, managing CKD is not possible. Avoiding kidney failure is also not possible. So, is your strategy to control phosphorus level working? This is what I want to focus on now, because as we have seen, it can save your life. And there is only one way to understand if this key level is in range. Take a look at your last blood works. The right range for serum phosphate is 2.5 to 4.5 milligrams per dl, okay? Anything higher than that and you are at great risk of a fast progression of kidney disease. So, what can we do if this level is out of range? There are 2 ways to keep phosphate levels down: limiting the intake and using binders. Let's do this now, starting with the foods. As usual, the diet is probably the most important step to improve your kidney function. So the big question is, what foods contain phosphorus? Most common dietary sources of phosphorus are dairy products, meat, poultry, and seafood. Processed foods such as deli meats, bacon, sausage, sodas, and sport drinks are also high in phosphorus. Since phosphates are used as food preservatives, foods such as baked goods, morning cereal, sauces, and many other packaged foods may also be rich in phosphate. And if your goal is to reverse kidney disease, all of these foods you see here in my list should be completely avoided. None of this is suitable for a renal diet. Now, there are other foods that contain phosphorus that don't need to be completely avoided. These include legumes, nuts, whole wheat breads, and cereals, and some vegetables such as asparagus, tomatoes, and cauliflower. So, as we can see, there are some foods containing phosphorus that you should completely avoid and some others you can still eat. But why is that? Why is phosphorus from some foods bad and from some others not? Because there are various types of dietary phosphorus, alright? This is important because the body will react very differently if phosphorus is coming from plant-based foods, from animal-based foods, or from additives. Phosphorus additives are a problem. Foods that have added phosphorus will cause your blood phosphorus levels to go up more than foods that have phosphorus naturally. phosphorus that is added to our food is nearly 100% absorbed. Phosphorus from meat and dairy is also highly absorbed. About 90% of phosphorus from animal-based foods ends up in our bodies, but you only absorb about 30 to 40% of the phosphorus from plant-based foods. And also, plant-based foods have way less phosphorus than animal-based foods, which means that foods such as legumes, nuts, seeds, and grains that also contain some phosphorus can still be part of your diet. And these foods have lots of health benefits. So if you have watched this part carefully, you may understand now why a plant-based diet mainly composed by single-ingredient food items is the cornerstone of the therapy for CKD, because phosphorus destroys your kidneys. In short, if you are following a renal diet, the first rule is avoiding meat, fish, dairy, and processed foods containing added phosphorus. Check the labels for phosphates. On the other hand, limiting foods such as grains, nuts, seeds, and other plant-based foods won't really help managing phosphorus levels. Now, very important, you can decrease even more your phosphorus absorption with a phosphate binder. So question, what can you use to decrease phosphorus absorption? Calcium-based phosphate binders are often used to keep phosphate levels down. Taking them with meals may be helpful because calcium carbonate sticks to the phosphorus in the foods you eat. The phosphorus is then removed through the bowel, effectively stopping your body from taking extra phosphorus in. So ask your doctor if you are not taking one. These also have other benefits. Since they are calcium-based, they can raise your serum calcium, which is usually too low in those with CKD. Another benefit of calcium-based phosphate binders is that they protect you from oxalates. Now, in the case study of the 81-year-old patient that went from stage 4 to stage 2 CKD just by decreasing his phosphorus levels, the patient was prescribed 2 to 4 grams of antacid tablets per day. He takes them with the main meals. This is a common prescription, but may not be right for you. This is why you must discuss this with your doctor. Remember that phosphate binders are not some fancy supplement or alternative medicine. They are widely used in CKD patients and also recommended by current guideline. If your doctor tells you that you don't need a phosphate binder with CKD, ask them why, alright? Ask them to write down exactly why you don't need a phosphate binder. Now guys, as I was saying, the most important part of the 81-year-old patient treatment was a vitamin. Immediate release niacin, a natural form of vitamin B3. Now, vitamins are not widely used to treat high phosphorus level in CKD patients today. This may change now. Let's see why. I have now personally observed more than 25 documented cases of individuals having their CKD progression not only halted but reversed with the addition of 3 to 5 cents worth of niacin per day. This is what the author of this study says about niacin and CKD. But are they right? Do you actually need to take niacin in order to reverse CKD? Well, yes, you are actually supposed to supplement niacin if you have CKD, but in low doses. You see, today, CKD patients are usually recommended to take all the vitamins of the big group. Niacin in particular can be very useful for people with high cholesterol levels because this vitamin will actually help you lower your bad cholesterol. But its main benefit is another. As the author of the study mentions, niacin can decrease phosphorus levels by binding to this mineral in the intestine. And guys, I believe that they could be right about this niacin-based treatment. I believe that in the near future, this will be a more common treatment that people with CKD will be able to benefit from. Keep in mind, however, that the dose that was taken in the study was pretty high. This vitamin in the dose the author of this paper used is something new, still relatively untested. So watch the video until the end and consult your doctor before even thinking about increasing your daily dose of vitamin B3, alright? More about the dose in a moment. Before, a very important question. How can niacin be the key to reverse stage 4 kidney disease? Niacin is a powerful form of vitamin B3 and it's very beneficial for your kidneys, says science. Many studies show niacin can lower high cholesterol levels, protecting your heart and kidneys. A review of studies published on the American Journal of Kidney Diseases concluded that Niacin has a favorable impact on multiple risk factors affecting the rate of GFR decline, such as HDL concentration and function, triglyceride level, oxidant stress, inflammatory markers, endothelial function, and serum phosphorus levels. The author of this meta-analysis published on AJKD believed that niacin may seriously decrease all-cause mortality in people with kidney disease. Now, phosphorus control is one of the main reasons why niacin is so helpful for CKD patients. As we have seen, controlling phosphorus is key to protect the kidneys. In short, everyone with CKD may benefit from supplementing low-dose niacin. Taking it in bigger doses may have side effects, but it may also be a way to stop or even reverse kidney disease progression. So, question, what dose niacin was used here? 100 to 500 milligrams of immediate release niacin 1 to 3 times a day is what is recommended in this study. But keep in mind that doctors recommend periodic liver function tests when taking 100 milligrams per day of niacin or more. In fact, if you are taking a renal multivitamin, you are probably receiving just around 20 milligrams a day of niacin. So, as I was saying, consult your doctor if you think a higher dose could benefit you. And guys, if you want to watch more success stories like this one, my video up here is for you. And this is all for today. Thank you for watching. God bless you all. Bye!